When I first met Louis, he was struggling fairly severely with arthritic conditions of both his knees. And he had let them go. He had known that his knees were getting arthritic and he was hoping to avoid surgery, but the pain and the loss of motion and stiffness got to the point where he was having trouble doing almost everything. And he came to me to get a plan as to how to help. So we started first with the one knee and performed one knee replacement surgery. He recovered. It helped his activity levels, and then when he felt that he was strong enough and that the knee had recovered sufficiently, he made a decision it was time to proceed with the other knee replacement.
I went to him to see about the knee, and I was very well satisfied with him, and he was very, very down to earth and very easy to talk to. He answered any questions I had, no problem at all. In fact, I was very surprised how easy it went, and when I woke up, how little pain I had. I was amazed how well it was.
Louis is a very independent guy. So he certainly did need some physical therapy, which we did both initially at home as well as at an outpatient physical therapy center. But he is independent and likes to be outside, walking, being in the woods, in his yard, and doing activities. And I think that has helped him recover just as much as actually the formal physical therapy did as well.
Everything went well. As long as I followed the instructions of physical therapy and went to physical therapy, it was fine. I would say if you don't go to physical therapy, you're lost. You're going to have problems.
Seeing someone who was in pain, who was limited in what they could do, and be able to see them back in the office and know that their pain is relieved, that they've been able to get back to activities, and that activity, especially as we age, being active helps your cardiovascular health, it helps your brain function. So not only am I helping a patient by taking them out of pain and getting them back to activities that they want to do, but I know that their general health, their brain function, their cardiovascular health is going to benefit from what I was able to help them with. It's the most rewarding thing that as a surgeon you could ever ask for.
I would highly recommend Shore Medical Center. It was excellent. The nurses, the doctors, everybody was excellent.